First, I would like to start with the historical perspective, how things were doing in the past in Turkey from radiotherapy perspective. In order to give the current status in Turkey, I will have a couple of slides to give feedback about the current status in the world so that we can understand where we're sitting in the world in terms of platforms, centers, and manpower. I will share some statistics and finish with the residency program. So the first use of radiation for the treatment of cancer in Turkey was in early 90s. And there were 17 centers giving radiation therapy with the X-rays, obviously, until 1923, where Turkish Republic was established. And those centers were majorly from military hospitals, public hospitals, and labs. After the independence war of Turkey, the proclamation of the Turkish Republic, there were quite device deficiencies in the healthcare because that was a big independence war. And the existing X-ray devices could not be operated. And the ones in working condition used for both for diagnostics and treatment, mostly in surgical clinics. In 1933, the university reform was set by Atatürk, and that was the time where the first radiology department and the Radiology and Biophysics Institute was established in 1933 in Istanbul University. Until 1950s, the physics department and most of the radiology department was being held by international scientists. The first time, the first radiation physicist, the Turkish radiation physicist named Seyfettin Kuter, he was a graduate of the Faculty of Science, Department of Physics and Mathematics, has been appointed as the first radiation physicist. And after that, radiological...
Can you hear us?
Sorry?
Can you hear us? Can you repeat from the start because there is no sound here?
Oh, can you hear me now?
Now, yes, we're trying to fix some technical problems. Just bear with us a few minutes.
Okay, then I'll start from the beginning, right?
Yeah, just but keep talking so we can recognize that.
Okay, yeah, I'm keep talking. Can you hear me?
I can hear you only, but the audience can't hear you.
Okay, I got you. Okay. But they can see my slides.
Yes, we did.
Yeah, okay, sorry for that.
And
okay.
Just 1 second, we'll fix it now.
Okay, I'm talking so that you can work on it.
Can you speak now?
Sure.
You speak now?
Yeah. Can you hear me?
No, still we can't hear you. Just 1 second.
All right. I guess I was the first person doing the presentation online. Is that right?
So please repeat from the start. If you don't mind, I will present you again. This is Professor Hale CAGLAR, radiation pathologist from Anadolu Medical Center. Please start again, Professor CAGLAR.
All right. Can you hear me now?
Yes, very well.
Okay, perfect. Sorry for that. I'm so sorry that I cannot be with you again this year. I was actually ready to go there, but things happen while unplanned. So for this next 15 minutes, I would like to update you about the current radiation therapy status in Turkey. This is my overview. I will tell a little brief history and then the current status in the world and current status in Turkey from the platform, centers, and manpower perspective. I'll share some statistics and finish with the residency program. So the first use of radiation for the treatment of cancer in Turkey was as early as 90s. And obviously it was with X-rays, and there were 17 centers doing radiation, X-ray radiation therapy until 1923, majorly in military hospitals, public hospitals, and labs. After the independence war, the proclamation of Turkish Republic, there was quite device deficiencies in the healthcare field in the country. The existing X-ray devices could not be operated, and the ones which were in working condition, they were used both for diagnostics and treatments, mostly in surgical clinics. But a major university reform was accepted in 1933 by the help of Atatürk. And that was a time where the first radiology department and radiobiology and physics institute was established. It was in Istanbul University. Until 1950s, most of the medical physics department scientists and the radiology scientists were from international countries. But until 1950, the first Turkish radiation physicist was appointed, Seyfettin Kuter, and he established the radiological physics and medical physics profession and education. And because with the help of this, new physicists were recruited and the medical physics unit was established. Radiation oncology was under radiology residency program until 1980s. Obviously, that was in different timelines in different universities, but roughly until 1980s. After 1980s, radiation oncology became a separate department and a residency program in the country. So let's look at the current status. In order to understand the current status, we need to look at the global cancer incidence. It's growing 2% per year. So it's been anticipated that the number of new cases or incidents will be like plus 10 million by the time 2040. And that is beyond the population growth. So 5 million new patients each year will need treatment equivalent to a 25% increase in new cases compared to today. And new cancer cases will grow twice as fast as population, increasing the share of people getting diagnosed with cancer. And most of those cancers will be needing radiation therapy. So when you look at the population distribution, the radiation technology infrastructure distribution in the world, this is majorly where the developed countries are sitting, and this is 15% of the world population, where on the other hand, Turkey is laying in between those. The majority of the world population cannot reach radiation therapy as the ones in the lesser part in the smaller part of the world population. So we need to increase the number of the platforms and the exposure radiation in this population in this part of the world. So this is a slide by Electa. I thank you for them. And this is a distribution of the world to access to the radiation therapy systems. As you can see, the cancer incidence growth and cancer incidence is mismatching with the number of radiation therapy systems in this part of the world. Especially, you can see this where Turkey is in between all of those continents. So this is the current status in Turkey, the external beam radiotherapy infrastructure. Roughly, there are 300 LINACs in the country. Most of them is Varian and Electa LINACs, where we still have 7.7% of Siemens LINACs as well. We have 10% tomotherapy, 13 CyberKnives, 3 ViewRays, 5 Unity platforms, and 14 Gamma Knife. The first APIX was installed, is being installed right now in Ankara. So this is the current status, the graphic, and we roughly treat 140,000 new patients per year in the country. Those are the timing of the purchases. This is a study by the Medical Physics Society. It was done until 2018. You can see that there is a fair distribution by the time of the purchases, and most of them are linear accelerators. This small navy graphic is at the brachytherapy. The number of the brachytherapy platforms is not enough compared to external beam radiotherapy devices. Those are the distributions by region. You can see that the majority of the external radiation devices are located in Marmara region, 129 within 61 centers. The Aegean region has 38 external radiation devices in 21 centers. Mediterranean region has 31 external radiation devices in 19 centers. Central Anatolia has 64 external radiation devices in 27th center. The Black Sea region has 17 external radiation devices in 11 center. The East Anatolian region has 12 devices in 9 centers. Southeast Anatolian region has 10 external radiation devices in 8 center. So that's an uneven distribution. Those are the distributions by region, the treatment platforms. Roughly around half of the treatment platforms are located in Marmara and Central Anatolia, where the Aegean, Mediterranean, Black Sea, East Anatolia, and Southeast Anatolia has the lesser number of treatment platforms. And those are the distribution by region in terms of centers. Again, the majority of these centers are located in the western part of the country. Those are the device and manpower for 1 million people. You see there is, again, an unfair distribution in terms of the western part of the country. Most of the device and manpower are located in Marmara and Central Anatolia region. This is the current manpower until 2018. We have 540 radiation oncologists, where with the calculation of the population, it has to be 680 to 740. We have 401 medical physicists, where on the other hand, we should have more. And we have radiation technicians, roughly around 1,000 radiation technicians, where we still are lacking in terms of radiation technician number. My last slide will be giving some information about the residency program. The residency program finishes in 5 years. Currently, we have 300 residents. Probably that will be increasing the number of radiation oncologists in the short term. We have a core education program, which is established by the Turkish Radiation Oncology Society. We have basic trainings for basic oncology, as well as technology, biology, and physics. And during our residency program, we have rotations, obligatory rotations in medical oncology, radiology, and surgery. So we can see a lot has been done since the first time radiotherapy was established in the country. Roughly every patient can reach to radiation therapy, and most of those patients are reimbursed by the government. That's a major advantage from our country's perspective, but still not as high as the developed countries. So we need to increase the infrastructure, but obviously it's not enough, because we need to standardize the machine status, the centers, and the manpower and as well as the radiation therapy application, because the quality of the radiation application cannot be as good as it cannot be standardized in every part of the country. So having enough radiation infrastructure is not enough. We need to increase the quality of the treatments as well. We have an uneven distribution per region as the regional parts of the world. So we need to have standardization for that as well. And that is the concept of Turkish Radiation Oncology Society. Thank you for your attention.